The latest news, updates, and more from the world of health and medicine. This is Medical Minutes, brought to you by Community Health Network.
A new definition for a frankly delicate matter. Wish TV medical expert Dr. Janelle Gordon is here with us this morning. If you're watching with children, be aware this is a sensitive subject, but an important one as well. Whether to consider a fairly common problem, a sexually transmitted disease. What's bringing up this conversation?
Yes, so a new study out of Australia is telling us that bacterial vaginosis, or BV, which is commonly occurring in females, could actually be a sexually transmitted disease or infection.
What is bacterial vaginosis?
Yes, so it's a bacterial infection that typically affects women, but in that study they found that the bacteria can actually be found in men in penile tissue and their urethral area.
Okay, so does it present with specific symptoms?
Yes, so some individuals may be what we call asymptomatic. However, oftentimes women will come in complaining of vaginal irritation, odor, discharge. For pregnant women, this could put them at increased risk of premature birth or even a miscarriage.
So the reason it would be considered sexually transmitted is, would it be in all cases? Because if it can be found on the man, then it can be transferred to the woman. Is that the only way that one could get that?
So historically, we've commonly seen this in females. We typically would tell individuals that it is more commonly occurring in women who are sexually active, but we've never been able to give it this classification. In this study, they saw that when the sexual partner was treated, the recurrence rate went down by over a half. And typically, even if we're giving women a course of antibiotics, which usually lasts about a week, it comes back in over 50% of women who deal with this.
So there may be a connection, at least worth exploring more, based on this study.
Exactly. So Australia, the researchers felt that they needed to put this out now. We do know that when a discovery occurs within healthcare or medicine, typically it's going to take around 7 to 10 years for it to become medical standard, but this is some hopeful information, especially for women who suffer with this frequently.
So it's not a new issue, it's just a new classification for it. Does that mean that treatments are already in place?
So there are some who are treating it as so based off of that study. We haven't seen it as much here in the U.S., but it could be on the horizon.
Antibiotics, what's the course of action?
Yes, an antibiotic course.
All right, Dr. Janelle Gordon, thanks for the information on that. Parents, bring the kids back in from the playroom, and we'll continue our morning checkup coverages frequently with our Wish TV medical expert, Dr. Janelle Gordon.
This is Medical Minutes, brought to you by Community Health Network.
Learn more and get more with Wish TV.
Online at wishtv.com, and when you follow Wish TV on Facebook, be sure to check out more great podcasts from the All Indiana Podcast Network now.
Now at allindianapodcastnetwork.com.